Just performed hand hygiene. Hi, my name is Claire. I'm a critical care nurse studying nurse anesthesia, and I'm here to do your assessment. So first, I'm going to look at your chest, anterior chest, and just make sure that there's not any like lifts or heaves. Looking at the precordium, and I don't see any. I'm gonna go ahead and do the carotid auscultation to make sure that there's not any breweries. Exhale. Good, no breweries. And exhale. Good, no breweries. Next, I'm going to palpate your costochondral junction. So with firm pressure here, 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 and here. Any tenderness? Good. Okay, so now I'm just going to put my hand here and push, go up a little bit, sorry, to feel for the maximal impulse. And it's good, no, just regular happy tapping, no lifts with that either. And then I'm going to move into my auscultation exam, and I'm going to put it to the diaphragm. So your aortic valve is the second intercostal space on the right, pulmonic valve second intercostal space on the left, midclavicular, Irv's point will be third, tricuspid, sorry, I'm just going to go down a little bit, thank you. In between the third and fourth, and then your mitral, I'll just go, yeah, perfect. Here, oopsies, like here. Okay, good. You have normal S1, S2. I'm gonna have you screen for your aortic valve and have you sit up and lean forward a little bit. Good, exhale. Okay, good. And I don't hear any high-pitched S1 or S2 there. So I'm gonna have you lay back down so I can listen to your tricuspid and mitral. So tricuspid's back in with the bell, third or fourth, or fourth or fifth, excuse me, fourth, and then fifth. Okay, nice and healthy, S1, S2, and then your mitral at the, good. And then I'm gonna screen for your valve to make sure there's no murmurs, so I'm gonna have you lay on your left side. Okay, perfect. And normal S1, S2. Great, okay. So you can, yep, perfect. Bend your knees a little bit. And I might have you scoot down a little. And then could you like, yep, do, yeah, perfect. Okay, so for the abdominal exam, inspecting of abdomen, she's non-distended, athletic, no bruising anywhere. And now I'm gonna auscultate in all four quadrants, assessing for brewery in the, okay, so right upper quadrant, right renal, left renal artery, left iliac artery, right iliac artery, and then I'll listen to your aorta. And I do not hear any breweries or any indication of turbulent flow. So now, and bowel sounds are present in all four, and now I'm gonna just gently palpate for here, here, and then firmer, pressure. Good, any pain? Great, okay, so next I'm going to percuss the liver. So I'll start at the, like, right marginal costal space, like right here. Like go up, nice and tympanic. Oh, nice and dull. So dull here, probably where the top of the liver is, and then I'm gonna start lower. So it's nice and tympanic. And dull here. So this is a healthy liver, it's within 6 to 12 centimeters. And next I'm gonna palpate your spleen. Here, I'll go like this, sorry, my like wrist doesn't have the best mobility. So I'll go here, here, and have you breathe in and out. So there's no change in sound. I'm not concerned for renal, or excuse me, I'm not concerned for splenomegaly. Okay, so next I'm going to just palpate. So I'll kind of go right underneath the rib cage to palpate the liver, breathe out. Any pain? Okay. And then also with the spleen, breathe out. Any pain? So I don't feel the spleen at all. I felt the liver marginally, but I didn't feel any nodes. And now I'm gonna palpate for the kidneys. And just firm, sorry, any pain?
Mm-hmm.
Okay, no nodules or masses. I'm sure if I actually felt the kidneys at all. And nothing here for the right kidney. Next I'm gonna see the margins of your aorta, so 2 finger widths above 2 inches above. Feel for your pulse, nice healthy pulse, and then I'm gonna kind of move a little bit away until I can't feel it. Good, and then kind of just put my finger here for a landmark. Feel the pulse, move away. So that's within 2 centimeters. That's normal and healthy. So great job. And now I'm going to move into the peripheral vascular system. So if you don't mind, like kind of hike your shorts up a little bit. Perfect. Great. So color's nice and your color's nice. You don't have any pallor or indication that you're getting poor flow. And then now I'm going to listen to your femoral arteries for any breweries. No. Sorry.
Okay.
No. No breweries present. Palpate. Nice strong pulse. Nice strong pulse. And I'm going to just compare to your radials. And they are matching. Okay, so next I'm going to test the inguinal lymph nodes, the vertical and horizontal chain. So I'll just like kind of work in the crease if you're going this way. I'm gonna have you bend your, perfect, yeah, perfect, sorry. This way, good, don't feel anything there, and then straighten this leg out and then the other, perfect. So yeah, just working in the crease, no lymph nodes on the inside as well. Okay, great. So next I'm gonna do assess your pulses, posterior tib, present +2, posterior tib +2, dorsalis pes, +2, and +2, and checking for peripheral edema, pushing for 5 seconds, assessing to see if there's any pitting edema, and there is none. Great, okay, so you can sit up and we can do the neuro exam.
All right.
First gonna test your sense of smell. So this is olfactory, cranial nerve 1 olfactory nerve. Okay, so close your eyes, close the nostril. Tell me what this is.
Garlic.
Yep, okay. And then tell me what this is. Close the other nostril, sorry.
Cinnamon.
Perfect, okay, so you can open your eyes. I'm gonna test cranial nerve 5, the trigeminal. So I would do, for sensory, I'm gonna tap your face in 3 sections. Tell me when you feel it.
Felt it. Felt it. Felt it. Felt it. Felt it. Felt it.
Good, and your eyes are closed. For this, the eyes would be closed during this. Okay, and then you can open your eyes, kind of clench your jaw. Good, so the masseter muscles are intact. And then open your mouth as against resistance. Good. Okay, so next I'm gonna test facial nerve, cranial nerve 7, and you wouldn't see this, but it would be testing your taste. So close your eyes and open your mouth. I'm gonna give you this. Okay, what is it?
Yogurt.
Yum. Okay, you're right. Okay, so lift up your eyebrows for the motor part. Puff out your cheeks and show me your teeth. Excellent. Okay, so now I'm gonna test this spinal accessory, cranial nerve 10. I'm gonna have you put my hand against your face and you're gonna turn towards me, rotating your head against resistance. Okay, good. And then this side. Good, and I can see the sternocleidomastoid masseter muscle work on when she's turning her to the right, and then I can see it on the right side when she's turning to the left. Okay, so now push up against my shoulders or hands. Good. Okay, relax. Perfect, and then hypoglossal, stick out your tongue midline. Perfect, great. So next we can go into the reflex exam. So first I'm gonna test your biceps. So just relax as much as you can. Good. Perfect. That was a good one.
Mm.
Good. Okay. And then I'm just gonna hold your arm here. Relax as much as you can. There.
Mhm.
Good. Perfect. Okay. And then scoot back a little bit so your feet are hanging. Okay. This is patellar. Sorry. Good. Okay. And then there you go. Okay. And then Achilles. Kind of do this. Ooh, good one. This. Good. And then I'm gonna test your the plantar. Or there you go. Good. So the feet curled in. And then good. And the feet curled in. So negative Babinski sign. We were good. So we are going to move into the cerebellar functions. So I'm gonna have you have your hands on your lap, and then one at a time just do this to test your rapid. Perfect. And then the other side. Perfect. And then just tap your feet on the floors because I'm about to touch your face in a moment. Well, I guess I just touched your feet anyways.
Okay.
Okay, cool. So yeah, so rapid motion, good in upper extremity, lower extremity. Put your elbow up to test coordination. Okay, touch your nose, touch my finger to your nose, good. Good. Oh, sorry, we'll do one more.
Okay.
And then I'm gonna go to midline. Good. Touch your, and close your eyes and touch. Good, perfect. Okay, other side. Midline, good, good, good. Back to midline. Close your eyes. Perfect. Okay, good job. Next, I'm gonna have you do heel to knee 3 times. Good. Other side. Perfect. Hands up to the sky. Close your eyes. And this is testing pronator drift. And I would see if her arm starts drifting down after 30 seconds. She's nice and healthy. I don't think it's going to, so we can just keep going with the exam so you can relax. I'm going to test your sensory now. So with your eyes open and your hand out, tell me if this is going to be sharp. This is dull.
Okay.
Okay. All right, so close your eyes.
Sharp. Dull. Dull.
Good.
Dull.
That was a trick one.
Sharp. Dull. Sharp.
My bad. I keep doing that.
It's okay.
We'll do it again. Sorry.
Dull. Dull. Sharp. Sharp.
Okay, perfect. And next we can move into the monofilament test. So with your eyes open, this thing is just, it's gonna bend on your hand. Like, well, it's gonna bend on your foot, but this is what it feels like.
Okay.
So I'm gonna go on 3 points of your metatarsal. Tell me when you can feel this.
Feel it. Feel it. Feel
In the
it.
base of the great toe.
Feel it.
Good, and the other side.
Feel it. Feel it. Feel it. Feel it.
Okay, perfect, awesome. So next I want to test your gait. So I have you stand up and just walk arms, like walk as you normally would. Good, so normal gait, you can stop there. Arms swinging good coordination, and come back on your toes. Good, and walk away on your heels. Perfect, and now act as if you're on a tightrope, heel to toe. Okay, perfect, and then jump on one foot. Good, jump on the other foot. Good, okay, and now I'm going to put your feet together. I hope that we're in here. I know we are. Okay, so yeah, feet together, and I'm gonna just stand here to make sure you don't fall. So close your eyes. This is a Romberg test, and I'm just testing to make sure that you are balanced. We would stand here for 30 seconds to make sure she doesn't fall. And we're gonna say that you're good. And that's the end of the exam. Thank you.
Thank you.
Let's make sure